Everyone knows that taking a vacation can be therapeutic. However, for thousands of Americans last year, a trip overseas was literally just what the doctor ordered. In fact, it's a relatively new concept called medical tourism, and it's gaining popularity. It's now not uncommon to find brochures for exotic foreign destinations that promise sun, sand, and surgery.
Well, medical tourism is a multi-billion-dollar business, and of course we're talking about people in the United States traveling to foreign countries for health care, and we think there might be as many as 150,000 people a year making that decision.
With the cost of healthcare rising on a global scale, it's not just Americans that are seeking different climes for medical treatments. In fact, there are some groundbreaking hospitals right here in the U.S. that are intentionally trying to reverse the trend by encouraging Americans to stay home for necessary treatments and attracting patients from other countries.
In Canada, there are a lot of people who are waiting long periods of time to have elective procedures. It may be a heart operation, it may be a hip replacement, a knee surgery. A lot of these people have some resources, so they want to come and get it done earlier. I think the second market that we see is in the U.S. Again, many people who need procedures that need to be done fairly soon. And some of those procedures are prohibitively expensive because of either poor insurance or no insurance at all. So if the cost is semi-reasonable, a lot of these people can have a procedure they ordinarily would have had to just forego.
Heart disease especially is a worldwide concern. For example, according to government statistics, heart disease is the #1 killer of adults in Canada and is the most costly disease in that nation. Heart disease has put a major strain on their healthcare system, and Canadians suffering from cardiovascular disease wait much longer for treatment than someone suffering from similar conditions here in the U.S.
So why do Canadians come to the United States, to Wichita, Kansas, for health care? And it's principally access. There's several major diagnostic categories that they have problems accessing. One is orthopedics, another is EP, heart rhythm issues, and the third is ENT. Ear, nose, and throat problems seem to be at the top of the list of services that Canadians can't access. We had an example of a board member of a hospital in Calgary who needed to have a hip replaced, and he couldn't get it done at the hospital that he was on the board of because of the services being so overloaded.
Interestingly enough, it is not just patients in foreign countries who are seeing the benefit of flat-rate fees for common surgical procedures. Uninsured and underinsured Americans have also been taking advantage of the discounts.
Many of these folks have resources, but they haven't been able to get insurance and are willing to pay a fair price, and we're willing to provide the services. We offer a flat rate. After we do an initial medical evaluation, we're able to guarantee that rate even if there are further complications.
According to Physician Hospitals of America, it is the reduced bureaucracy in physician-owned hospitals that allows them to offer discounted rates without compromising patient care. Patients who have had the discounted procedures found that lower cost did not mean lower quality health care.
It was just such a miracle to us to be able to just write a check for something and come through this without absolutely turning our lives upside down, because we were sincerely facing 100,000 plus anywhere else. It's just unbelievable, the skill and quality of these people, and top that off with the care and the concern, sincere concern.
And it isn't only hospital administrators and patients who are seeing the value of so-called reverse medical tourism. Employers and many insurance companies like the idea too.
Employers and insurance companies love flat rates because it allows them to cap their liability. And in fact, several insurance companies have added us to their network as an option, and they pass those savings on to the patients.
Well, I think the future of medical tourism in the United States is very bright. I think people want to stay close to their home, where they feel comfortable, where the language is the same and they're used to the customs and norms, and a lot more of the family members can come. So if more hospitals, as I believe they will drop their prices, take a real good look at what they can do, as we can with cardiology, cardiac surgery, and orthopedics, then the more hospitals will do this and there'll be more advantages for the people to stay.
Are you or a loved one considering traveling to a foreign country to save money on heart surgery or other extensive medical procedure? Stop. Before you book that overseas flight, there may be a better way right here in the United States.
Why should a patient come to the U.S. for medical tourism rather than going to Asia, for example? And I think there's several key reasons. Number one, the blood supply in the United States is much safer. Number two, there's a possibility of acquiring an infection in Asia. I think thirdly, it's a very long trip, and it's hard to imagine a 20 or 30-hour trip in the recovery stages of major surgery.
In February of 2008, Galichia Heart Hospital in Wichita, Kansas, made medical history with the dramatic decision to charge a flat fee for several common operations, lowering the average cost of each surgical procedure by as much as $25,000. Ever since, escalating healthcare costs on a global scale, combined with the weak dollar, have attracted patients internationally to this world-class surgical and orthopedic center.
Well, I had the angiogram, and while I was under the anesthesia and they were doing the angiogram, they came out and told my wife that I was too bad to stent and that I was going to probably need bypass surgery. So it was just a super good decision on our part, because for one, we could just drive here, and the savings were comparable to traveling overseas.
We took a look at our costs. We know we're very efficient in what we do. We know that we get very good results. And by doing that, we know we could compete with the overseas places.
The Galichia Heart Hospital is owned by physicians, creating a unique healthcare facility for both the practitioner and the patient. Founder Dr. Joseph Galichia's lifelong dream was to create a place where patients could get high-quality care, education, diagnostics, and treatment, all under the same roof. Galichia Heart Hospital is the realization of that vision.
We've tried to keep the cost down and yet have a profit margin. The only way you can do that really is to have a low complication rate. And I think the second thing is we live in an environment where our fixed costs are not quite so high as they are in the rest of the country. I think the third issue is that we have a very streamlined administration here. We don't have to go to a large committee with a layer of bureaucracy. We can look at it quickly, make an assessment, and say, this is what we think it will cost you, and guarantee that.
Galichia Hospital is a new age hospital. And by that I mean we try to blend medical excellence with all the support services that make you feel comfortable. For example, we have a chef that was trained in New York at Hyde Park at the Culinary Institute of America. We have all private rooms. We don't have elevators. We're a one-story hospital. It's easy to park and reach your room without having to walk a long, long ways. So I think all these together provide a very patient-friendly, family-friendly environment for your recovery.
I can't encourage people enough. I mean, and I do at home. Every day I tell people that they need to look into this. It's fantastic that they have it right here in the United States.
The Galichia Heart Hospital, a general acute care facility, has been long recognized as one of the primary cardiology treatment centers in the nation. For over 10 years, Galichia has been dedicated to providing world-class care. Now, through flat-rate billing, they are ensuring more people around the corner and around the globe have access to that care, proving they are a hospital that can not only fix your heart, but also has a big one of their own. For more information, log on to GHHospital.com.